I chose to do my report on childhood epilepsy. Childhood epilepsy is a seizure disorder. Epilepsy usually is diagnosed after more than one seizure occurs. A seizure occurs whenever there is a disturbance in the electrical activity in the brain. Epilepsy in children is caused by premature birth, injuries and complications during birth, genetics, and some underlying health conditions. To help with treatment and diagnosis, seizures are put into two different groups. They can be focal or generalized, and this is based on where they begin in the brain. Focal seizures begin in one part of the brain and tend to stay in that one area, while generalized seizures happen throughout the entire brain. Some focal seizures can begin as focal, and they can eventually spread and become bilateral tonic-clonic seizures, and that would end up being a generalized seizure. So focal seizures can be aware or impaired aware seizures, and if they are aware, it means that they know what's happening, but they can't control anything. And then focal impaired awareness is whenever they aren't aware, they're usually confused or dazed and very hard to communicate with for a few minutes after. And generalized seizures, they can be tonic-clonic, and that's usually the grand mal seizures. Those are the ones that are very, very dangerous, and usually injuries might come from that. And tonic-clonic seizures are characterized by the jerking and stiffening of muscles, and usually sometimes falling occurs and injuries and loss of consciousness. Myoclonic seizures occur whenever there are very short jerking movements, so it's different from the clonic seizures, where clonic seizures are longer periods of jerking movements or muscle spasms. Myoclonic is just very quick and short. Atonic seizures occur whenever there's a loss of muscle tone or just the muscles relax. And then generalized absent seizures are very hard to diagnose because you can't really see the symptoms as well, and usually it's just staring or rapid blinking. So some of the risks that come with epilepsy are playing sports or swimming, because if a seizure occurs during these, there is obviously the risk with swimming, drowning, or choking on water, those kind of things. And injuries can occur during a seizure, or choking on anything can occur during a seizure. And so the treatment for epilepsy, most children usually, the first option is anti-seizure drugs. So anti-seizure drugs are medications that help combat those seizures. And then sometimes lifestyle changes and management can help, and usually depending on how severe the seizures are, or their case of epilepsy is, if it has affected their development and they're really young, and they may need occupational therapy or physical therapy. And usually sometimes they can try a different diet, which is now known as the keto diet. A lot of people with epilepsy do end up doing the keto diet. There's also VNS therapy, which is vagus nerve stimulation therapy, and that is where there is a battery placed underneath the chest muscles in the child, and then wires are connected to the vagus nerve, or the left vagus nerve. And so whenever a seizure is about to happen, the child can use a magnet and place it over the area where the battery is on their chest, and it will send signals to combat that seizure. It can either stop the seizure from happening, or it can just make the seizures less severe. And also, the VNS therapy battery will send off electrical signals every few minutes or so on its own without the magnet. So the prognosis for epilepsy in children, many children do outgrow their epilepsy, and so that's why it is very common for them to outgrow it, and some people don't know that they even had it. And so their response to treatment is very important and is a really big factor in how fast they recover, or how fast they can recover. And sometimes it's not as lucky for some of them. They might have some situations there is SUDEP, which is sudden unexpected death in epilepsy, and that doesn't occur very often. It's rare, but it can occur in about 1 out of 4,500 children with epilepsy each year. And so it's usually not something that you would expect, but it can happen. So whenever there is a seizure happening, if you notice a child having a seizure, and usually this is whenever it's one of the generalized seizures where you can see what's happening, you can tell their symptoms. So seizure first aid, what you would do, step 1, you would be calm and begin to time the seizure, because timing the seizure is very important to helping with either diagnosis or treatment, or just letting doctors know and determining if further medical treatment is needed. And then also checking for a medical ID, because some children will have a little bracelet or a medical ID on them that helps the person caring for them know what their seizures are like and what they can do to help. And then step 2, placing a barrier, a soft, flat barrier underneath their head to prevent brain injury, if you can, is very helpful. And then step 3, moving objects that are harmful away from them, because they can't control what they're doing. So if there's anything around them that is unsafe, it can cause harm to them. And also removing anything tight around their neck. If they have tight clothing or a tight necklace or anything like that, removing that, because that can cause like choking. And also turning them on their side, because they can choke on something. If they are on their back, they can choke. So that's a big factor in helping them recover from that seizure, is turning them onto their side in case they do vomit, or because some will. And so in case they do vomit, turning them onto their side will help, because otherwise they might choke. And so then the last step is, once they have recovered, call 911 if their seizure has lasted for more than 5 minutes, if they're having trouble breathing, if they have other health conditions like diabetes, and also if it's their first seizure. It's very important. Or if it occurred in the water. So that's like the big risk. If in swimming, if a child is in the water and they have a seizure, that's a very big risk. So that's usually when you could also call 911.